Namaste everyone. My name is Dr. Sameer Nanaware. I've been practicing as a physician and a chest physician in Mumbai over the last 18 years. Today, I would like to talk to you about management of hypertension in diabetic patients. As you all are aware that diabetes itself is a silent killer, and in India, it is growing in the proportion of an epidemic. When you have hypertension as a comorbidity with diabetes, then it becomes even more lethal because the complications of both the diseases together, such as cardiovascular diseases, neurological diseases, risk of stroke, risk of kidney dysfunction, peripheral neuropathy, and other systemic complications becomes much more higher. So it's very essential that all your diabetic patients, the way their diabetes is well controlled, even their hypertension needs to be extremely well controlled. The target systolic blood pressure has to be less than 140 millimeter of mercury, and the target diastolic dysfunction or the diastolic pressure has to be less than 90 millimeter of mercury. You have to make sure that patients follow proper diet the way they do it for their diabetes management. Their salt intake has to be restricted. Patients need to be put on proper medications for hypertension the way they take it for diabetes. And you make sure that the patient blood pressure is controlled throughout the day. They should not be on surges of blood pressure where the BP goes up and down in the entire day period, because even that is good enough to cause end organ damage. So make sure your diabetic patients are well controlled with antihypertensive medications. You have to choose the right drug for the right patient because diabetic patients are prone for kidney diseases. So when you give an antihypertensive medication, make sure that the drug itself does not cause any kidney injury. Once your blood pressure and diabetes is adequately controlled, then the lifestyle of this patient becomes equally important. They need to be on a proper diet with good amount of rest and exercise. They need to maintain their waist circumference, the body mass index, all becomes important factors in controlling hypertension and diabetes together. So overall, in conclusion, I would like to say that the choice of antihypertensive in the form of an angiotensin receptor blocker or an ACE inhibitor, which can prevent renal dysfunction in patients of diabetes, is the first line of treatment. So giving right medications at the right time and making sure that the blood pressure is controlled is very essential in management of hypertension in diabetic patients. Thank you.